Today, we will continue our new topic, which is Chapter 5, Joints. To begin with, in this chapter, we will learn about joints, consisting of joint classification, types of movement in synovial joints, and the skeletal system and much more. Before you go deeper into Chapter 5, you should know the learning outcomes for this topic, where at the end of this lesson, hopefully, you will be able to explain the types of joint classification such as functional classification, state the type of movements of joints and illustrate the joints in diagram. What do you know about joints? Basically, joints can be defined as the point at which two or more bones are connected. Joints give the skeleton mobility and hold it together. Joints can be classified into two, namely functional classification and structural classification. For functional classification, there are three types of joints, namely based on their movement. The three types of joints in functional classification which is namely based on their movement are synarthrosis, ampharthrosis, and diarthrosis. Synarthrosis has no movement, and known as immovably fixed joint between bones connected by fibrous tissue. For example, the sutures of the skull. While ampharthrosis is a joint that has slight movement or a joint that has limited mobility. For example, the cartilaginous joint. Diarthrosis is a joint with free movement, or known as any freely movable joint. For example of this joint is the shoulder and hip joints. While for structural classification, the joint we're naming based on the material binding the bones together, such as fibrous, cartilaginous, and synovial joints.
The fibrous joint is the joint that do not allow movement or also known as an immovable joint. They do not have a joint cavity, and the fibrous tissue which connects the bones is made up of collage fibers. The best example of a fibrous joint is a skull. The other structural joint is the cartilaginous joint. This type of joint can be divided into two, such as synchondroses and symphysis. Synchondroses is connected by hyaline cartilage. Examples of the synchondroses are the first rib and manubrium, and epiphyseal plate. While the symphysis is connected by broad hyaline or flat fibrocartilage such as in vertebral disc between body of vertebrae and manubrium and sternum. The other structural joint is the synovial joint. The synovial joint is a freely movable joint. In a synovial joint, the ends of bones are encased in smooth cartilage, or known as articular cartilage. Together, they are protected by a joint capsule lined with a synovial membrane that produces synovial fluid. The capsule and fluid protect the cartilage, muscles, and connective tissues. Bones are separated by a fluid, containing joint cavity which allow free movement as it known as a freely movable joints. Most joints of the body fall into this class. For example, all the joints of the limbs. Basically, there are 6 types of synovial joints, which are gliding, plane, joints, saddle joints, hinge joints, pivot joints, ball and socket joints, and ellipsoid joints. Gliding joints allow movement in one plane and saddle joints are biaxial joints with one concave and one convex bony facet. While the hinge joint is a monaxial joint that allows angular movement in one plane. Pivot joints are monaxial joints that allow rotation. Then the ball and socket joint is a triaxial joint that allows rotation and other movements, and finally, the ellipsoid joint is a biaxial joint that clamps one bone in the oval depression of the other. So now, we continue with ligaments. A ligament is defined as the tissue that connects two bones together at a joint. It is elastic, strong, and durable and has the function of strengthening joints and limiting movement in a certain direction. Besides ligaments, there are tendons. Tendons are tissues that attach muscles to bones. Tendons are inelastic, strong, and tough and function to assist in joint movement and limit muscle movement. Returning to the synovial joints, intervertebral articulation is one example of a gliding joint. In this intervertebral articulation, Vertebral bodies form symphysial joints that covered by intervertebral discs. The outer part of this articulation is known as the annulus fibrosus and the inner part is known as the nucleus pulposus. Not only that, it is stabilized by ligaments. Then, we have the shoulder joint, or known as the glenohumeral joint. This joint consists of the glenoid cavity and the head of the humerus, as well as the ball and socket diarthroses. Glenohumeral joint stabilized by ligaments where strength and stability are sacrificed for range of motion. Elbow joint. These joints only allow flexion and extension movements involving hinged diarthrosis and are reinforced with strong ligaments. Then, the hip joint. The hip joint involves ball and socket diarthroses and allows several movements such as flexion, extension, abduction, adduction, circumduction, and rotation. It is also stabilized by many ligaments. The knee joint is a hinge joint with an incomplete articular capsule. It is formed by the condyle of the femur and the condylar surface of the tibia. This joint not only helps stabilize lateral movement, but also allows flexion, extension, limited rotation and is supported by ligaments. So now,